When we talked about this in terms of diabetes a little bit, but I think it plays into heart disease as well. How big is prevention and not going down that road where you have to reverse something and just taking care of it before anything happens?
Well, that's certainly my goal when I meet patients for the first time, and hopefully I meet them early enough, at a young enough age, that we can start bringing in some of those lifestyle modifications early on so that they don't have to be as concerned about developing cardiovascular disease, developing type 2 diabetes. In my opinion, prevention deserves 90% of our attention. That is 90% of our attention as a medical community, because we're about to be overwhelmed by type 2 diabetes. We don't have enough primary care providers. We don't have enough healthcare facilities. The costs and complications are skyrocketing. We're really not prepared for what's happening to our public. And it's pretty staggering, but over half of our patients that are greater than 65 years of age, so these are patients with Medicare, over half of them have type 2 diabetes. So again, we have, say, insurance companies, healthcare providers that maybe aren't emphasizing prevention enough, and then when they get really sick, they pass the buck on to our federal healthcare system. And to me, that's unfortunate. So really the solution is going to be focusing early on, and perhaps even in utero, that is while women are pregnant, making sure that their unborn children are exposed to healthy diets and nutrient-dense diets so that they're not born with risk factors that predispose to diabetes. We now know that risk goes all the way back to that time. So, so it's my goal, it's my hope that we do get more prevention efforts. That said, despite knowing that type 2 diabetes is preventable, we know that through the diabetes prevention program, we still don't see major insurers launching diabetes prevention efforts. It's interesting that the diabetes prevention program is being spread throughout the country, but that's actually happening by the YMCA in our communities. It's actually a community-based effort sponsored by the CDC, not so much a medical effort sponsored by our major medical insurers. I think that's unfortunate.